Welcome to the Strategic Management module. The course code for this module is ST40D4, and my name is S. Dube, and I'm going to be your tutor for this module. Let's look at the course content. This course or this module consists of the following units: Introduction to Strategic Management, Environmental Scanning, Strategic Management of HIV and AIDS Programs, Strategic Planning for HIV and AIDS Programs, Supply Chain Management, Human Capacity Development, Core Indicators for the Implementation of the Declaration of Commitment on HIV/AIDS, Monitoring and Evaluation of National HIV and AIDS Strategic Plans, Governance and HIV and AIDS Management. Learning outcomes. The aim of the course is to equip students with skills for strategic planning for HIV and AIDS programs at national and organizational level, equip students with pertinent knowledge and skills required in the construction of monitoring and evaluation indicators for HIV and AIDS services, provide information and best practices helpful in strategic management of HIV and AIDS programs, give guidelines on formulation, implementation, and monitoring and evaluation of HIV and AIDS programs. Introductory overview. This module looks at the development and the role of national HIV and AIDS strategic plans and the fundamental principles, broad strategies, and institutional frameworks, but also the intermediate steps that need to be achieved in order to change the current epidemic situation faced by a country into one that represents the objectives to be reached. The module explores how strategic planning takes on issues underlying determinants into account, which vary according to the persons concerned, e.g. their social class, religion, culture, gender, specificities, and according to the situation that may alter rapidly over time. Strategic planning means adopting norms to a given or changing situation. This module sets up in units or sections that are easy to study and give practical guidelines in formulating, implementing, and monitoring and evaluation of national strategic plans. During the past 15 years, many different approaches have been adopted in an attempt to slow the spread of HIV and AIDS, minimize its impact on individuals, families, and society. It is now clear that there is no simple formula that works for all countries. The most effective national response are those designed to meet the specific needs of the country. They attack the particular situation that make people vulnerable to HIV, its impact, and make use of particular strengths of the country's people and institutions. Governments engaged in the development planning must understand the real magnitude of HIV/AIDS problems in their country. They must also have an idea of the epidemic's likely consequences on the individuals and families and on the society's overall development. On that basis, they must then decide what important and priority levels they want to attach to actions aimed at reducing the spread of HIV and mitigating its impact. This implies focusing on strategies that can change its course and securing the resources to implement them. It also means the strategies will become an integral part of the country's overall development plan. Strategic planning allows governments as well as planners at more decentralized level to make informed decisions so that they can change the current situation of their objective. The different options discussed in this manual should meet the needs of planners at national level for building a more general strategic framework for HIV and AIDS action. In addition, as international efforts to increase access to healthcare, pharmaceutical, and supportive services for people living with HIV and AIDS and their families are strengthened, the need for information on monitoring and evaluation also grows. The different options discussed in this manual should meet the needs of planners at national level for building a more general, specific framework for HIV and AIDS. In addition, as international efforts to increase access to healthcare, pharmaceuticals as supportive services for people living with HIV and AIDS for their families, strengthen the need for information and monitoring is also growing. Monitoring and evaluation indicators are intended to provide information for local, national, and international programs on key trends in the delivery of HIV/AIDS services. Monitoring and evaluation activities allow country health authorities and their partners to assess the extent to which programs are being implemented and are achieving the intended objectives. Tracking trends over time through routine monitoring and evaluation efforts will help program managers and decision makers in assessing how successful programs are meeting the goals. Pragmatic, well-coordinated, and strategic monitoring and evaluation activities are essential to minimize the burden of data collection on country partners while maximizing the usefulness of monitoring and evaluation data for decision making. Tracking trends over time through routine monitoring and evaluation efforts will help program managers and decision makers in assessing how successful programs are in meeting the goals. Pragmatic, well-coordinated, and strategic monitoring and evaluation activities are essential to minimize the burden of data collection on country partners while maximizing the usefulness of monitoring and evaluation data for decision making. Now, let's look at the assignments. Assignment 1, the National Strategic Framework recently came to an end, and evaluate the outcome of this plan and the key lessons which came out of the strategic plan and the Ministry of Health's way forward for the next plan. So you are first of all supposed to acquaint yourself with the entire National Strategic Framework, and also it will require you to actually go to Ministry of Health and ask for the evaluative report in order for you to really write up a good assignment at the end of the day. Good corporate governance is a cornerstone for ensuring that organizations are run effectively and efficiently. Critically analyze the NAM code in line with HIV/AIDS management in Namibia. Give relevant examples in the Namibian context. So in terms of corporate governance, normally all along people have been leaning on what we call the King 3 report. But Namibia has since developed its own code called the NAM code in terms of good corporate governance. So you are therefore required to read through this book and make sure that you actually respond to your assignments based on that guideline. Assignment 3. The National Development Plan 5 of Vision 2030, or what is known as NDP5, was launched recently. Comment on the key elements of NDP5 and explain in detail the monitoring and evaluation tool in that document. So you realize that when you go through the NDP5, it's a well-written document. They are very clearly defined in issues of monitoring and evaluation. So you are supposed to look at that document, do your assignment in line with what is actually contained in that document based on the monitoring and evaluation mechanisms. Now, assignment 4, ethical leadership is an imperative in strategic management. Discuss and give relevant examples in the public, private, and NGO sector. So there's never been a time where ethical leadership is being called upon. And most of the time we just expect government to behave ethically, but you realize that ethical leadership is a core cross-cutting element which must feature strongly in the public, in the private, and NGO sector. Because what happens is that when leaders behave and live ethically, organizations, agencies, ministries are run effectively and efficiently, and that way people are able to access goods, quality goods and services at the end of the day. So you have to discuss your assignment in line with that. Assignment 5, corporate social responsibility, or what other people call corporate social investment, comment on the depth of this concept in Namibia in the fight against HIV and AIDS. You realize that all companies are mandated to plow back at least between around 1% of their profits before tax towards corporate social responsibility or corporate social investment. Therefore, this corporate social investment, how is it dedicated? How is it channeled towards the fight against HIV and AIDS? So what this requires of you is basically to visit some of the top companies in Namibia and look at what it is that they are doing towards the fight against HIV and AIDS as part of their corporate social responsibility. Assignment 6, comment in detail on the blueprint plan by the Ministry of Poverty Alleviation and Social Welfare. What role do you see yourself as an HIV coordinator playing in the mainstreaming of this plan in HIV/AIDS programs in your organization? I think you realize by now that Namibia is one of the first country in the world to have a ministry which is dedicated to fighting poverty. Also in line with that, the ministry, which is still very new, they launched what they call a blueprint plan. So what it means is that you must access that blueprint plan and read it through, very well detailed. And if you cannot access it online, I will actually encourage you to go to the Ministry of Poverty Alleviation and request for that document. If you are living outside Windhoek, you can actually call the Chief Public Relations Officer. His name is Lord Monomata. He's a very friendly and very accessible guy. He's going to send you all the information, and then you'll be able to actually go through the documents and read through and really write a good piece of work. Assignment 7, critically evaluate the entire supply chain management of the Ministry of Health and Social Services procurement system of HIV-related goods and services. So procurement is a very, very broad and big thing. So we would like you to really look at what are the processes that are involved in making sure that everything that is related to HIV is available when it is needed in various parts of the country, be it test kits, be it medication, be it all these things that we normally see happening or being used in counseling centers or in hospitals or clinics. Assignment 8, critically analyze the Harambee Prosperity Plan and its relevance to the strategic management and give examples. You realize that the president, when he took power, he actually took some elements of NDP4 and amplified them, and the amplification is contained in a document called the Harambee Prosperity Plan. And therefore, it's a well-written document, very well detailed. It's very interesting to read. I've read it a couple of times, and I keep on reading it. And therefore, you are supposed to look at how this document fits in with the elements of strategic management from your perspective as an HIV/AIDS coordinator and give relevant examples. And once again, as students, you are strongly encouraged to read extensively before attempting your assignments. My contact details are readily available in your tutorials. Feel free to contact me, and I wish you a happy and exciting journey ahead.